Hello, my name is Christopher Jamie, and I will be performing the drawing up insulin skills video. Here's my badge. These are my supplies, and I will go ahead and start. Oh, sorry, I have gloves, medication vials, alcohol swabs, and 1 milliliter insulin syringe, which is this one. Okay, so to start the video off, I'm gonna go ahead and verify the healthcare provider's orders. And then I'm going to go ahead and verify the 6 rights of medication administration. So the first one's going to be right patient, right drug, right dose, right route, right time, and right documentation. Once I get all 6 rights of medication of administration, I'm going to go ahead and proceed and check the medication in the EHR. Once I check the EHR, I'm going to go ahead and verify the MAR. So to verify the MAR, the doctor has ordered 4 units of regular insulin and 8 units of NPH insulin. That's a total of 12 units. So subcutaneously, 12 units subcutaneously. Once I'm done verifying the medications and the dosages, I will go ahead and gather my supplies, enter my patient's room, close the door behind me to ensure patient privacy, place my supplies down on a clean, flat surface, and go ahead and introduce myself to the patient. Hello, my name is Christopher, and I will be your nurse for today. I'm going to go ahead and ask for their two identifiers. May I have your first name, last name, date of birth? They're going to tell me the information. I'm going to verify on the wristband. Once I verify, I'm going to use that opportunity to verify the medication and make sure it's going to the right patient. Once I'm done verifying, I will go ahead and ask the patient if they have any food, medication, or environmental allergies. In this case, my patient has no allergies. So we're going to go ahead and proceed. Once we verify that, I'm going to go ahead and perform hand hygiene. Apply my new gloves, clean gloves. Gloves are on. Okay, so Mr. John, insulin is a hormone that regulates blood sugar. Regular insulin is short acting with a fast onset. Now, NPH insulin is it's an intermediate acting insulin, so it has a slower onset. Just so you're aware, some common side effects. It's going to be hunger, tremors, sweating, mild injection site pain, normal. Some adverse side effects or adverse effects. It's going to be seizures, headaches, or confusion. If you do experience any of these, please let us know right away. It's very important. You may feel a burning or stinging sensation on the site of injection. It's completely normal. Okay. Now, do you have any questions for me, Mr. John? No? Okay. So, now that my patient is fully aware and has no questions, we're going to go ahead and proceed. So in this case, my patient, their blood sugar is 142, which is it's appropriate for insulin administration. My patient's next meal will be served in about 30 minutes. Okay, let's move on. So now I'm going to go ahead and verify the MAR again. I'm going to call another nurse for the whole entire process to verify with me. The order is confirmed of 4 units regular insulin and 8 units of NPH. That amounts to 12 units total. So I'm going to go ahead and start by rolling my 2 vials gently with my hands just to warm up the solutions. Okay, like so. Now I'm going to go ahead and clean the tops of the vials with individual pieces of alcohol swabs. One use per vial only. Want to clean it pretty good. My trash is here. I'm going to dispose. Another, here, I'll dispose of this. Another alcohol swab. Clean the top vial. Dispose of alcohol swab once done. Now I'm going to retrieve my insulin syringe from the package. Put both vials next to each other. Now, to start off, I'm going to go ahead and I'm going to draw 8 units of air. Okay, I'm going to verify with the nurse and I'm going to verify with the MAR, and I will show the camera like so. Okay, once that's done, I'm going to take the cap off, place it gently, and now I'm going to inject the syringe into the MPH vial. Without getting any solution on the syringe, I'm going to go ahead and push the plunger like so. There we go. Just going to verify with the nurse, verify with the camera that I injected the air into the vial. Now I'm going to go ahead and draw 4 units into the syringe. Okay, 4 units. Verify with the nurse. Gonna verify with the camera. Okay. Now I'm gonna go ahead and inject into the regular vial, regular insulin vial. Push the plunger, invert the vial, and I'm going to draw 4 units of regular insulin. Okay, that's 4 units of regular insulin. I'm going to tap to remove any air bubbles. Okay, I'm going to verify with the nurse and I'm going to verify against the MAR, and I'm going to show up to the camera real close. It's 4 units. Now I'm going to go ahead and inject the syringe into the MPH vial. Now I'm going to go ahead and invert, and I'm going to draw 8 units, totaling up to 12 units of insulin. I'm going to be careful not to push the plunger or overdraw. Okay, 12 units drawn. I'm going to go ahead and tap to remove any air bubbles. Verify with the nurse and verify against the MAR. And I'm going to go ahead and show the camera 12 units. You can see that. Okay, 12 units. Now I'm going to go ahead and cap the syringe. I'm going to use a scoop method. Like so. I'm going to go ahead and cap, and now I'm going to go ahead and just place down. Okay, since the insulin was prepared away from the bedside, I'm going to label the syringe with the right name and dose, and I'm going to dispose of the supplies properly, and then I'm going to go ahead and remove my gloves and hand hygiene biostat hand hygiene. And now I'm going to go ahead and ensure that the patient is comfortable. And I'm going to give him the call light and ask him if he has any other questions for me before I exit the room with my supplies. And I'm going to go ahead and document. Okay, thank you for watching.